Good afternoon, everyone. We'll wait a couple more minutes to give some people time to sign on. Thanks for coming. Good afternoon, everybody. Welcome to our Contra Costa Health Plan Q3 Provider Network Training. Very excited to see everyone. I know it's tough in the summer when everyone's on vacation, but still wanted to be able to provide everyone with some training this quarter. So I'll have us go to the next slide, please. So this is the agenda that we'll be covering during today's network training. We'll start with a welcome and introduction, and then we have a guest speaker, Dr. Sarah McNeil from Contra Costa Regional Medical Center, who will be speaking about abortion services. Then we'll have Peja Kadson, our Director of CalAIM and Transitional Care Services, to speak about our foster youth transition. Utilization from our Cultural and Linguistic Services program will be then talking about language services. And then I'll be substituting for John Carpetta, and I'll be providing some authorization and utilization management updates. And then I'll close out our agenda with some Chief Medical Officer updates. If you have any questions or anything you want to bring up, please feel free to utilize the chat. We will include time for questions after every speaker, assuming that we continue to meet our meeting pace. But thank you all for joining and looking forward to our training today. I'll now turn it over to Dr. McNeil, who will be speaking about abortion services.
Thanks, Dr. Lowe. I am Sarah McNeil. I use she, her pronouns. I am currently the medical staff president at Contra Costa Regional Medical Center, but also an abortion provider. There are a lot of people who are out on parental leave who offer abortion services. So I don't have any slides. I was just gonna draw something up on the whiteboard, actually. So if I can go on camera, that would be great. So because folks are out on parental leave, I wanted to review with you guys the kind of workflow for people who come to and have CCHP, who have a positive pregnancy test. I'm just going to turn around like old school. I'm going to turn around my computer and my whiteboard here and kind of draw out a little bit of the flow. So when people have a positive pregnancy test, and they have, they can have one at home, or in our system in any capacity. They can come into Healthy Start in our system or an office. And from there, they will get options counseling. And the decision will go then, if they desire having the pregnancy, then they get referred to prenatal care. And if they don't desire the pregnancy, then there are a lot of options. So this is the section that I'm going to be talking about. If a patient has a positive pregnancy test and then from Healthy Start gets referred to abortion services, the patient can go to Planned Parenthood. There are multiple Planned Parenthoods throughout the county. In Walnut Creek, they offer abortion services on Tuesdays and Fridays. Hilltop also offers an integrated system throughout the week. And then there's a San Francisco clinic that operates on Thursdays and some Saturdays. The advantages of going up to Planned Parenthood, they provide up to 18 weeks gestation. They do moderate sedation. So if the patient has a ride home or they take Uber, they can get a mix of fentanyl and Versed if they want to and be comfortable for the procedure in Walnut Creek. And then there are also a lot of services that are offered through CCRMC. So the services offered through CCRMC are mostly through our FPS or Family Planning Services Clinic, which is Monday, Wednesday, and Friday in the morning in Martinez. It's an integrated clinic, so it sometimes feels a lot safer to not have to walk through the protesters at Walnut Creek and is integrated into care with CCHP. In the FPS clinic, you can get a medication abortion up to 11 or 12 weeks from with a positive pregnancy test. And patients can do this in the privacy of their own home, so they often prefer that. There's a great smart set if you're on Epic that's available for all of the providers. And I'll offer a bunch of resources afterwards, so you can use that as well. We do procedural abortions within FPS clinic up to 10 weeks from last menstrual period. We offer Ativan, oral sedation, and ibuprofen for patient comfort. And within 5 to 10 minutes, the patient can leave after the procedure only takes 5 to 10 minutes, but the whole process takes a couple of hours. And then the patient can leave not pregnant, which is often very good for them. It's what they want. And then the last option within CCRMC is OR cases. We provide heavy sedation, really conscious sedation up through general anesthesia. And we go 10 weeks to 21 weeks from last menstrual period, and offers comfort for the patients. They have to come in for a pre-op appointment and then be referred to the operating room. So it's a little bit more logistical, talking to the social workers and the entire care team. We also have referrals to Alameda and SFGH in San Francisco. So those are available. And then all of these are available through the social workers that we work with. And there are lots of resources online that I will put in the chat. So those are kind of the big overview of what's available in terms of abortion services for CCHP patients. And I'm happy to take any questions.
Dr. McNeil, I was wondering if you would be able to perhaps give our primary care providers on the line some guidance, with all of the legislation across the country, conversation around the country about abortion services. What assurance can our primary care providers give their patients about obtaining abortion services in the state of California, and if there are any issues that they should be worried about?
Yeah, it's a great question. There's definitely lots of fear because abortion is in the news so much, but we are really lucky in California that the legislation and the Attorney General are all extremely supportive of a right to choose. And so it really, the decision and any follow-up and consequences really stays between the provider and the patient. All of the laws that have been suggested, for example, making mifepristone illegal, do not hold true in the state of California. So we feel extremely protected. I'm a very visible abortion provider online. There are people can, Google my name, and certainly the protesters at Walnut Creek are pretty intense, but I still feel very safe and public as a provider. I think that the biggest thing for abortion providers in California is that we all come to work every single day with our own stigma and biases, and there is a lot of kind of your own work around values clarification as a provider that you often need to go through. So in the resource teachtraining.org, there's stuff on It's a free online resource available to everybody, and there's a lot of stuff to really explore your own biases and how you provide these services in an open and compassionate way to make sure that the patients are getting what they want, and it's about kind of their values rather than focusing on any of our values as providers. So that's a really good resource.
Thank you. Dr. McNeil, there's a question in the chat. Which providers do we contact to arrange for a provider for abortion? So I know that for our CPN providers who do not practice at CCRMC, how can they reach out to CCRMC, if they're interested in having their patients see an abortion provider there?
Yeah. Do the CPN providers ever have Epic access?
They use a portal.
Okay.
But I don't believe it's not a direct referral to CCRMC.
Yeah. So there are social work consults, and the social workers, I put the number in the chat, but you can call the social workers to like start the Healthy Start process for the patients to go through with a positive pregnancy test that I outlined. There also, you can always call labor and delivery, which there is an OBGYN and family doc there 24 hours a day, 7 days a week. And they can help to like navigate the whole process. The referral system it's totally possible to do through these phone calls, and often because it's like sensitive information and sensitive timing. We do a lot of kind of calling and making sure that people's needs are met however they are best, however they kind of come to us. And the social workers are really good about calling and following up and not leaving messages, waiting for the patients to call them, but also doing referrals or getting somebody on calling labor and delivery and asking one of the people on call to put in a referral for your patient for you, so that the actual referral is within Epic. Just streamlines the process pretty easily as well. Yeah.
Do you know, Dr. McNeil, whether they can put the referral to the family planning? What would be the referral?
FPS, yeah, family planning specialist, yeah.
So if they can put an order in through the referral in through the portal,
yeah,
FPS would be the keyword to put in.
Yeah, for sure. Yeah, and there's often, when people don't want to be pregnant, most of our patients are really early in their pregnancy, and they have lots of time where all options are really safe and effective. And also, when the patients don't want to be pregnant, they want to get expedited care, like we all do for so many things. And we have an amazing team of people who are really here to support you guys, the providers, in getting patients the timely care that they need. So don't feel shy about reaching out to the social workers and labor and delivery. The providers in labor and delivery know how to get patients the services, and we want to be a support for you. We also have an on-call pager system for the patients who get procedural and medication abortions with us, so that they don't feel alone in the process, that they always have a doctor on call, a resident with backup from the attending 24 hours a day, 7 days a week, so that, they don't have to go into an environment that might be hostile for them, but rather we will support them over the phone as much as possible.
Thank you. Any other? Sorry, go ahead.
I'm just always available on email, Sarah McNeil or smcneil@cchealth.org. So you can always reach out to me via email, and my cell phone is there too. I'm happy to get texts from you guys if you need to help navigating the system in any capacity.
Great. Thank you, Dr. McNeil. Any other questions from the audience?
Hi. Wait, actually, sorry. No, I'll hold off. I don't actually know what we're asking. Sorry.
Oh, okay. No worries.
I do have a question, but I don't know what this particular segment's on. I'm just hopping on. I'm sorry.
We're talking about abortion services. Okay. All right. Any other questions for Dr. McNeil? All right, great. Thank you so much, Dr.
Thanks
McNeil.
for having me. Yeah.
All right, let's go back to our slide deck. All right, I'll turn it over to Peja Gadsden.
Hello, everyone. Thank you for being with us here today. So my name is Peja, and I'm the Director of CalAIM Programs and also Transitional Care Services. Next slide, please. So essentially today what we're going to go over is a little bit of an overview of the mandatory enrollment for foster children and youth starting 2025, background and rationale as to why we're doing this, key changes and benefits, provider responsibilities and support. Okay, next slide. All right. So beginning January 1st of 2025, we're going to start having the Department of Healthcare Services essentially is mandatorily enrolling all current and former foster care children and youth from fee-for-service Medi-Cal to managed care plan Medi-Cal. Okay? And really the whole purpose of doing this is because we know that our foster children and former foster youth are vulnerable populations, and we really want to enhance their continuity and quality of care for those youth and really provide more coordinated and comprehensive healthcare services. Next slide. Okay. So again, as I said, these are vulnerable populations. They have unique and complex healthcare needs, and historically they've been reliant on fee-for-service Medi-Cal, which unfortunately can really sometimes lead to fragmented healthcare, as you see some of the challenges in the fee-for-service Medi-Cal. Those children and youth that are also within fee-for-service often have limited access to really specialized services. So again, the purpose in transferring them from fee-for-service and mandatorily enrolling them into the managed care plan is to really make sure that we're focusing on more of integrated healthcare services, expanding their reach to have more of those specialized services and access to a broader network of providers. And also other benefits for them, including more coordinated and comprehensive healthcare services, and really overall better management of their healthcare needs. Next slide. So some of the key changes and benefits that will happen when they're transferring from fee-for-service to regular managed care Medi-Cal is going to be the continuity of care. So pretty much it's going to be a seamless transition for them to make sure they're able to go ahead and continue the care that they've been receiving from December 31st of this year to January 1st of next year, and continuing on for that post-2025 transition. Also going into the managed care plan from fee-for-service, they're actually going to have access to enhanced care management. Our ECM programs, they're specific populations of focus for our children that are and youth that are involved in child and welfare up to age 26. And that overall helps them really navigate our complex healthcare system. Again, they're going to have access to a much more comprehensive provider network once they're going ahead and mandatorily enrolling into the managed care plan, which again increases their access to specialized care. Again, there's really going to be an emphasis on preventative care, including those regular checkups, immunizations, when we're talking about our EPSDT, overall really proactively addressing their different health issues. And really that goes ahead and links into those that we are enrolling in enhanced care management. They'll also have their behavioral health integration and overall different supports and services that we can go ahead and offer at the managed care plan to go ahead and promote health literacy really among the foster youth and the former foster youth. Next slide. Okay. So when we talk about this, often providers want to know, well, what is my responsibility when it comes to this mandatory enrollment of the foster youth into CCHP? So really, we want to make sure that our foster youth are having timely access to appointments, just like with everybody else, recognizing that at times they have a need for urgent and really overall consistent care. We want to make sure that our providers are continuing, as you do, to go ahead and collaborate with our CCHP case management team. And really to go overall implement comprehensive care plans tailored to the foster youth. Continue to go ahead and provide culturally competent care, really acknowledging again that these are vulnerable youth and that they also come from diverse backgrounds and experiences being foster youth coming from this population. And as you are today, is going to be continuing to participate in CCHP's different training sessions and educational programs that are going to be offered to better understand the needs of this vulnerable population. And the big thing that we want to make sure that we're supporting you all is that CCHP is committed, as we said, to continue to go ahead and support our providers throughout this transition with those different training sessions and also educational programs. As we continue to move into this transition the rest of this year and also beyond the transition. And overall, we continue to appreciate the partnership that we have with all of our providers, and any feedback or any areas that you would like us to go ahead and provide that education really for this vulnerable population. Please feel free to go ahead and let us know, and we can go ahead and tailor the next offerings to that. And that's everything I have. I'm open to questions. See if there's anything in the chat.
I don't see anything there, Peja. Any questions from the group? All right, thank you so much, Peja.
Thank you.
All right, next slide, please. All right, I'm going to turn it over to Otelia to talk about language access and interpreter services. It's all yours, Otelia.
Great. Thank you, Dr. Lowe. I'm Otelia Teusen, and I'm happy to be here with all of you to go over some of the language access services. Next slide, please. So the first slide here, I just wanted to give you kind of an overview so you can see the breakdown of our members when we look at their preferred language. So when a member signs up for Medi-Cal, they fill out this information on their application, or when they come into our system, we ask them at registration. They also get something in the mail. So we actually have really good data on members' preferred language. I believe we have over 90%. So you can see that some of the most popular languages other than English is Spanish with around 24%. And then we have other languages that are emerging, such as Chinese, Vietnamese, Dari, Tagalog, and so on. So I also wanted to point out that when the providers get credentialed, we ask if they speak a second language, and we also ask for their race, ethnicity. And one of the things that we have to do for our NCQA accreditation is we have to share and prove and show that we have providers serving our members that are culturally aware and they're very diverse. So the more providers share their information, such as foreign languages that they speak or race, ethnicity, the better it is for just promoting the cultural diversity of our provider network. And that's really important for some of these accreditations. So you can see that at this time, we only have about 1,500 providers that have shared with us a foreign language. And then for race, ethnicity, I believe it's less than that. So we encourage you to share that, and our numbers are going to keep improving. Next slide. So getting proper linguistic access really helps our members. When you think about members who are in need of getting some medical attention or having an emergency, it's so important to have clear communication. So we want to make sure that there's clear communication. We don't have medical errors that are occurring, that the patients are really satisfied with the service, that their compliance is up to par, that they follow through with instructions, that they understand the testing and all of that. And we strongly discourage the use of family and friends, because many times there can be errors, or it can, especially if it's a child that is asked to interpret for their parent, it can cause guilt and trauma and all kinds of issues. So we really discourage that. Now, if the family prefers to use a family member who is an adult over 18, they have that right, but the law is that we have to offer them free interpreter services that the health plan provides or the hospital that they're at provides. And then the office has to document that into the patient chart. And if they refuse, they also have to document, and they're allowed to use a family member over 18, but it has to be offered that we have interpreter services for them. Next slide. So again, like I said before, the law requires that we make that offer. We also offer American Sign Language. We have a page on our website on the section for providers. We have an interpreter services tab, and this is mainly for community providers because our CPN providers, we also have a section for them. They have very specific instructions through the language access department for CCHS, and they use healthcare interpreter network, which is all through video at the county hospital and clinics and telephonic. But then for our community providers, we have a special page with very specific instructions. They call this number listed here. We provide this 6-digit client ID. We don't have this client ID on the website because it's confidential and we don't want it out there everywhere. But we include it in our provider newsletter and in this presentation, or if they call provider services, or if they call member services, they can get this number. And then if they meet the criteria for face-to-face, there's an option to submit their request through the website. If they need help with telehealth appointments, we offer them support with that as well. Next slide. So we also offer assistance with translation of documents. Many times I will get emails from providers that say, you know, I have all these forms that my members have to fill out, my patients have to fill out, and we only have them in English. We are happy to support you to get them translated in different languages that you have a need for. And all you have to do is email me your document in a Word format without any PHI, and I will forward it on to our vendor to get it translated. Next slide. And lastly, I want to make sure that you're all aware of this California relay service. Some people are using it all the time, and then I get calls or emails from other doctors' offices who've never heard of it. So by dialing 711, the California relay service has a speech-to-speech service where there's an operator who will talk to you, and then they type the information for a person that is hard of hearing or may not be able to hear at all, and they have a special machine where they get the information in print and then they respond back to you. So this is a really important service that I just want to make sure that you guys are aware of, and it's 24 hours a day, 7 days a week. And I believe this is my last slide. I'm happy to answer any questions if you have them.
Great, thank you so much.
Sure.
All right, we'll go to the next slide. So I will substitute for John Carpetta today, and we'll be sharing some authorization and utilization management updates. So first, I kind of wanted to go over our provider portal. Strongly encourage that our community providers and specialists and PCPs who use our portal to use it to submit authorization requests. It's the most straightforward and it's the most expedient. So kind of wanted to go over what is involved when you are sending a referral to Contra Costa Health Plan for prior authorization requests. So the first step is to select a referral. On the home screen, you will see these 4 icons on top. Select the one that says create referral. And then you would then search for the specific patient that you are looking to place a prior auth request for. Just strongly encourage everyone to confirm that the name and date of birth are correct. There are a lot of individuals with similar names, so we do not want to unfortunately place a referral for the wrong individual. Next slide. Then you fill out general information that pertains to the service that you were requesting for this patient/member, and any field that has the exclamation mark over the stop sign symbol, that is a hard stop, and that must be filled out in order to continue. For example, find location POS also needs to be filled out prior to the referred by and referred to section fields. And if you're unable to find a specific location, unfortunately our systems are not updated quite so real time. So if you are unable to find the provider of interest, choose a generic place of service or contracted place of service, and then put the full name and address of the desired provider in the notes section. And then you choose next. And then if you also free text, that may be a way to help you find some suggestions if you're looking for something specific. Next slide. Then, most important, we really need you to attach the clinical notes and the medical justification, any notes that would apply to the prior authorization request. Our utilization management team uses these details and clinical information to perform our medical necessity review of the services that are requested so that we can appropriately provide authorization for medically necessary services. And this is also the section, as I mentioned before, that if you were unable to find the provider you are looking for, you can enter that information free text in our notes section. And then once you've finished all of your information, you can click request referral. Of course, if you did not complete all the hard stops, that will, you will need to complete that before you can continue moving forward. Any questions on this? So there is a question in the chat from someone regarding the translation. It says, we often have documents in Spanish brought to us by patients, x-rays and labs. Can you translate these? And I think to Otilia's point from before, with personal health information, we want to avoid having that, but other items, I believe, Otilia, they'll be able to translate.
Yes, feel free to just email them to me. They have to be in a Word format. So, but we'll get them translated for you, yes.
Thank you. All right, next slide, please. So I do want to, remind everyone, we've shared this before in previous provider network trainings, but CCHP is making, a very aggressive effort to convert services to those that do not require authorization. So these are all delineated in our prior authorization matrix. And so for services that are considered no authorization required, and the provider is a contracted in-network provider, there's no need to submit a prior authorization request. If you happen to do that, we will process the request and send a no authorization required letter. The letter itself is not required for the visit to take place. I know that this is a new process for many people, so we are happy as an organization to provide education. So if you happen to be referring to a provider and they are requesting that an auth letter be sent for a no authorization required service, please let us know and we can communicate with them and provide this more one-on-one education. And you can also email us and then we will reach out to them. Any questions on this?
No questions, but if I can, I just have one comment, Dr.
Sure, of course. Go ahead, Peja.
Just so everybody knows, the process to enter referrals for the CalAIM community supports and ECM is slightly different because the providers, just so we know, are embedded within the referral. But to Dr. Lowe's point, the tip sheets that are at the very front of the portal in orange, if you scroll to the bottom of that section, it gives detailed guidelines and screenshots to show you how to enter a CalAIM referral if you do ever have one that you need to enter.
Thank you, Peja. And at the end of the day, if you're trying to place an order or your team member is trying to place an order and they're having trouble, please do not hesitate to reach out to us and then we can provide that support. We're also working on, as our organization, providing regular portal training / office hours to be able to support our providers and their teams in navigating these portals. I know every provider on this call who takes multiple insurances is probably working with multiple portals, which all have their own nuances. So we're happy to be there to support. And we're trying to make this as streamlined as simple as possible. Next slide. Great. Also wanted to talk about the Epic inbox that's available through the portal. And so this is the means of communication that our utilization management teams may reach out to you, the provider, and your teams about any requests for additional information. So for example, our goal is to review every request for medical necessity. However, if we don't have enough clinical information to be able to make that judgment, we may need to reach out to you, the provider, to obtain more information. Now, please keep in mind that we are under very strict turnaround times with all of our state regulators. So we do that if there is time available to ask for requests. We do expect a prompt response, or else we will not be able to adequately review the request. Any questions on this? All right, any questions overall that I can help with regarding authorizations and utilization management? There is a question in the chat about translation. It says, regarding translation, do you also have Spanish phone translators that can assist providers with patient consultations? And yes, we absolutely do. On our website, and also provided in these slides, Otilia has shared information about how to access our translator services. And there are a multitude of languages that you can access to be able to speak with your patients. And as a provider myself, I have definitely use these services for Spanish patients, and it has been very, very helpful to be able to communicate, because these are, certified translators who understand the medical lingo. So it's very helpful and very important. So we will be sending the slide deck and the recording. So if you missed that previous slide, that slide will have that information, but also this information can also be found on our website, our CCHP website. Any questions about authorizations and utilization management? All right, we'll move on to the next topic. So just wanted to provide some general updates for the group on this call. So next slide. So I wanted to talk about what's coming soon for us as an organization here at CCHP, and kind of wanted to highlight two topics that are probably going to be of large interest to the providers that we serve. Next slide. So coming soon, our CCHP organization will be undergoing our annual audit with the Department of Healthcare Services on August 19th through August 30th, 2024. So our teams are already actively preparing for the audit, and then we'll be, getting drilled for those 2 weeks, and then hopefully be able to manage any findings or any questions that they have for us. And like Peja mentioned earlier, we will be carving in the foster youth in January of 2025. Next year, our organization will also be undergoing our regular audit with NCQA, and we will also be looking for accreditation and health equity. And then really looming large in January of 2026, Contra Costa Health Plan will be adding in a Medicare Advantage dual special needs plan. So essentially, Contra Costa Health Plan will be providing Medicare as a line of business to our Medi members who opt in for CCHP as their medical advantage plan. So more training and more information to come on that, but we will be reaching out to our providers to see if we can also contract with them for Medicare related services as well. Next slide. So I wanted to share with everyone, go back one. So our utilization management team has been working very diligently on something we call the DME project. And so on our authorization matrix, it's a little vague and could be much more clear when we do not need prior auth and when we do for durable medical equipment, aka DME. So our team has aggressively reviewed all of the Medi-Cal codes that exist for durable medical equipment, and we have determined based on code what requires auth and what does not require auth. So that will be forthcoming later this year, because we do have to build that into our Epic Tapestry system, and then also make sure that we update everything we need to from a regulatory standpoint to be able to provide this information for our providers. So stay tuned, that is coming soon, and hoping that it will provide some additional clarity for our providers and their teams when requesting DME for their patients. Next slide. And then also kind of pivoting off of that, CCHP has been actively working on creating a web-based CPT code search tool. So essentially we're hopefully by the end of the year or early next year, to have a search tool in place where our providers and their teams can go online, type in a CPT code or type in some keywords to determine if something requires prior authorization with CCHP. And we would break this down by line of business. So essentially, if you are a surgeon like myself and you're trying to find out if a laparoscopic cholecystectomy requires a prior authorization, you would type in 47562, which is the CPT code, and then it would tell you that it requires prior authorization for all of our lines of business. So we're hoping that this will make it a lot easier for our providers and their teams to be able to navigate our prior auth process, and also help, frankly, decrease the amount of work that our providers and their teams have to do, and also simultaneously help our team here at CCHP do a little less work. Really helping to also improve, most importantly, access to care for our members. Any questions on these items that I've shared? There is a question in the chat for the CPT code search tool. Could it also specify by place of service? For example, in office versus outpatient surgery. This is very helpful. I will take that back to our team to see if that is something that we actually need to differentiate by. I think we may overall just make a decision based on code and it would apply for all places of service. But let me take that back to our team to see if there's something that we can do based on that. Any other questions? Next slide. All right, next slide. Well, thank you everyone so much for joining. Really wanted to provide a shorter but sweeter provider network training during the summer. So thank you so much for participating.
Sorry, I do have a question. Like it just wasn't related to the current slideshow.
Okay.
Is it okay for me to go ahead?
Sure.
I mean, my name is Kaval. I'm a provider with Lifelong, a pediatrician. I was just hoping, it's something that's been on my mind to ask and reach out for, but so now that I'm on this meeting, I just want to make sure to ask. I would love to have a list of optometrists that are accepting CCHP, and it feels like we used to have kind of one, and then I've had some people from my office say they've reached out and been told from CCHP that they can't have a list, and that each patient has to reach out on their own. So I just wanted to clarify and see if we could get a list of optometrists that are contracted or that they can use with the plan.
Sure, thank you for that question. So we have a provider directory online, and there is also a hard copy of it, but I will say the online version is much more up to date with who we are contracted with. I believe you can search for optometry as a specialty, and then it would list who we have that's contracted for that specialty.
Okay, and our referrals person, I'm sure, has access to this provider directory.
It's a public website. It's a public
website. So I can just search
literally, if you Google CCHP provider directory, it'll probably be one of the first 2 hits.
Okay, and then I can get a list and I can put like cities or something like that in like I could put locations, for example, that I would like for.
Yeah, so you can search by your zip code and indicate the geographic distance you want your patient to go to. So if you encounter any issues, please feel free to let Kim CC know. She and I meet monthly to talk about any issues. And so if you're finding trouble with the provider directory in that respect, I would appreciate that feedback. So that way I can give that information to our provider relations team. I will say, like all insurance plans, our provider directory is not 100% perfect, but it's as close to reality as we can get given, technology, but it's pretty good. I use it myself when I'm trying to find like a GI provider or a dermatology provider, because as you know, many different insurances are contracted with many different people.
Yeah, great. And then similarly, I guess to the no authorization required that you were mentioning before, I see that letter back a lot, like when we refer to audiology.
Yes.
And so does that mean that I should just be not putting in referrals for these services?
Well, I mean, you need to put in a referral as a physician for the member to get from point A to point B, but you don't need to submit a prior authorization request for CCHP. If the service itself doesn't, so basically, essentially, it has to be a provider that we're contracted with and that is in network for the patient. So if those 2 things are met and the service is something that doesn't require prior authorization, then you don't need to send it to us.
Okay, and there's like a list
saves
of
your team the work, and
like
it saves your team the work.
So my team should just know, like, to look for this before they send it to you guys, so that.
Yeah, I mean, we send the letter because we are required by the state to send the letter once we receive a request, because we're beholden to the process. But the letter itself is not what is needed for either the patient to be seen or for them to bill. Correct.
Okay, so the referral is still needed, but
so
the patient should be able to just go ahead and schedule it.
Yeah, so essentially, just to be very simple, for all specialties except for neurosurgery and transgender currently, those are no authorization required services except for when it's an in-network contracted provider. So essentially, if it's a non-contracted provider or if it's a tertiary provider like UCSF or Stanford, those require prior authorization.
But any specialty care does not require prior authorization. So our team doesn't have to send any, as long as it's in network. And so I think Children's Hospital of Oakland is in network for
Correct.
And I have been peds, so I do only children, like most of my referrals are to there. So everybody, they don't need to send it to you guys.
No.
They just need to send the referral to the contracted provider.
Correct.
Okay.
Correct. Except for neurosurgery and transgender currently, but we're hoping to make that change soon.
Wonderful.
Yeah.
Thank you.
Try to make it easier for everybody.
Yeah. I don't know if they know that, but it's good information to pass on.
All right, I think someone shared the link for the provider directory on the chat. I'm not sure who did, but thank you. It should be easy to access and use, but again, if you have any trouble or have questions, don't hesitate to reach out. All right, any other questions from the group? All right, well, hearing none, have a wonderful day and please enjoy the rest of your week.
Thank you. Bye.
Bye.